So this is Kate Fassett, Vice President of Development at Valleywise Health Foundation. I'm here with Dr. Quan, the Chair of Emergency Medicine at Valleywise Health. And we're really excited to have you here today. Thank you for joining us. So I just wanted to, start with a little bit of background. If you can share with myself and with our donors and our team a little bit about you, why you chose emergency medicine, and toxicology, as that's kind of your fellowship specialty.
Well, where to start? Why medicine? Well, I actually started off as an engineering major, and I worked in Silicon Valley for about 10 years. So developing new products, working on communication systems, all that sort of fun stuff, I thought at the time. And I never really thought about becoming a physician at all.
Interesting.
And so I always want to become interestingly, an EMT, an emergency medicine technician, medical technician. So I said, this is my time. I can go do this. And so after work, I would go to my EMT classes. And about 9 months later, I got my EMT certificate and just kind of thought, hey, what am I going to do with this? So I started working at event, taking care of patients that are at events. So sporting events, maybe some like Renaissance festivals and just things like that, providing first aid. And then I eventually transitioned to working on an ambulance. And so I worked on an ambulance for a little while I was working as an engineer. And I just got the bug to apply to medical school. And here I am, like, however many years later, I decided that medicine is the right path. So I went ahead and went for it, and here we are. How
old were you when you changed professions?
I was 32 when I applied. Well, I started the process when I was 30, and then it took a few years to get my prerequisites and take the test and apply. So I started medical school when I was 32.
Wow. I imagine that makes your residency experience a little different than somebody who's younger, just having had a career and understanding that, how that works. And is there something that stood out in your residency experience that you've been able to translate into your teaching experience at Valleywise?
Well, I think as being I'll call it an older student and an older resident, I don't think I could do it now, but back then, I think it helped me kind of gain perspective on why we do things, and maybe a little more patient. I don't know. You would ask if you ask my family, I'm probably not as patient as patient as you would think I would be. But I think it just gives you a different perspective and different goals in life to sort of get your accomplishments done, and also maybe my interests as well as my goals in my career are a little bit different.
Now, how did you then merge in from straight in out of your residency in emergency medicine? How did you follow that path down to toxicology?
So toxicology is one of those happenstance things as well. I never wanted to be a toxicologist. Interestingly, through residency, I had an interest in toxicology because a lot of our patients in the emergency department are toxicology type of patients. They would come in poisoned. They would come in with overdose. They would be exposed to things, and so I always was interested in how to treat those things. And finally, in my last year of residency, it just happened that I was talking to my friend, and he said, you ever thought about being a toxicologist? And I said, no, I really haven't. So I'm glad he pointed me in the right direction. And now, years later, and 2 years of fellowship, I'm a toxicologist. So interesting.
How does that change your perspective in working with our patient population and, in just a public health setting? Does that affect your decision making or help with your teaching experience as well for our young residents?
What toxicology does is it enhanced my training as in medicine. So if I didn't do a toxicology fellowship, I wouldn't have learned some things that maybe I wouldn't have considered working just as an emergency physician, because it does entail some inpatient work as well as caring for patients other than just the emergency. You do have to concentrate on taking care of the patient for a longer amount of time and kind of looking at other details in their care, not just the specific, let's say, a couple of hours that I would typically spend with the patient. I have days to talk to them and get to know them. So it's a little bit, the work is different than emergency medicine.
Interesting. Okay. So now I think I want to transition. How did you end up at Valleywise? Why do you continue at Valleywise? And kind of what is your driving force and what is your why?
So I started at Maricopa Medical Center, now known as Valleywise Health Medical Center, in 2007 now. It took me a while, so about 13 years or so. And I attended medical school in Phoenix at Midwestern. So, I've always known about Valleywise or Maricopa, and I thought, wow, that would be a great place to work because it's a county hospital, and you see different things. And then as I went through residency at another county facility, I just sort of grew attached to that sort of patient population and those sorts of challenges that you would face with taking care of patients like that. So that's what the draw is here at Valleywise, is to be able to serve the patients that we take care of, as well as teach the next generation of physicians.
Amazing. So I know you're probably getting a lot of this. What would you, or how would you describe a typical day now? Like what would today present in your emergency medicine department?
So today, pandemic-wise, the pandemic has really changed the way we practice medicine, as well as how we not necessarily treat patients, but we do. I guess we've adjusted the way we treat patients just because of the nature of the transmission of the disease, as well as the possibility to get the disease. I don't think I will say we weren't as careful back before COVID-19 was present, because for whatever reason, I guess we thought we had a handle on a lot of these on a lot of these sort of a lot of these medical conditions like the flu, colds, all of these transmissible diseases that we've always worked with in the emergency department. I guess we were a little lax compared to now. And so now we do have to spend time protecting ourselves as well as our loved ones, our coworkers, to make sure that we're all safe. And it is a different environment, and it is somewhat stressful because you walk into a situation now when you're taking care of a patient, and it's really an unknown patient. You don't know if someone has COVID-19 or not. And I think that puts an added amount of stress onto the care of the patient, whether it's from the physician side, from the nursing side, from the assistant side, the technician side, the pharmacy side. All of those things now are a huge factor in taking care of the patient. And that's why I think as time goes, I personally think that we're a little bit mentally fatigued and burnt out from doing all of this stuff. But as true professionals, my nursing colleagues and physician and advanced practice providers, we've all stepped up and we've taken care of patients like we always have.
Do you see the environment kind of, as we hopefully get a handle on COVID over the coming months or year, do you see that environment changing and getting a little more lax in the emergency department? Or do you think this will be a new norm just as a protective measure from whether it be COVID or future illnesses?
I think it certainly has opened our eyes up as a profession to practice maybe safer, practice safer. Let me see, how can I properly say this? I think it's changed the way we practice medicine in general and how we care for patients from the hygiene side, because now we are we are very vigilant on putting our masks on and putting our gloves on, and using hand sanitizer and washing our hands and keeping our workstations clean. There's a higher level of hygiene or cleanliness that we are concentrating ourselves on now these days, and making sure that our shoes don't enter into the home. And there's a lot of little things that I think we would have just sort of disregarded or thought they were trivial, and now they are kind of at the forefront of our minds.
How has this changed how you educate, how you interact with residents and have them interacting with patients? I assume it's an extra layer of protection for them as well as what you were just describing. But is there any change in how they interact or how your teaching experiences with residents?
Yes. The residents are learning along with their attending staff and the rest of the people that work in the hospital. Is this is really important. I will say that let's say if I never see another pandemic like this, I have seen one, but the chances are the physicians that we're training the physicians that are in training now will end up seeing another pandemic similar to this in the future. And this will only help their training. It will help them prepare for these sorts of things in the future. I hope I never see another pandemic myself.
Let's hope.
Yes.
Let's hope that we won't. A couple of other questions focus more on residency and why Valleywise is such an epicenter for teaching here in the Valley. What is it about Valleywise? Is it the patient population, or, alluding a little bit back to your residency experience and choosing another county hospital, what is it about Valleywise that makes it such a robust teaching environment? And, why are so many medical students clamoring for this opportunity to learn here?
I think if you call it the county hospital setting, you see that sort of thing everywhere in the media, even like the TV series ER was based on Cook County Hospital, so the thought is, when you work at a county hospital, you get to see all kinds of things that you normally wouldn't see at another facility. The residents do drive a lot of the care here, and I think that's where we are able to direct their care to something that we all aspire to, good patient care, doing the right thing for the patient, doing the proper workups, utilizing resources appropriately. A lot of times, with our patient population, it's difficult to sort of hold back on some of that testing just because they don't have the follow-up providers that maybe somewhere else in the Valley or somewhere else in a community could have. And so we tend to do a little bit more, and we tend to take care of our patients, I think, at a different level than others would take care of their own in a different community.
How do you think, or maybe talk a little bit about the Creighton Alliance, what it is, and how it will change medical education for the better here in Arizona? Because I don't think many people quite realize how substantial this is.
Yeah, the Creighton Alliance is will change the face of medical education, I think, in Phoenix. There are a lot of training systems or training. I don't want to say training systems, but there are a lot of training facilities in Phoenix in general. And Phoenix is such a big city that I think there's still room to grow. But you always look towards the certain training facilities like Creighton maybe, or some of the other ones in town to say, here I'm going to get the best training because they have the ability to let me see a wide variety of different types of patients that I maybe I won't see somewhere else, or maybe you only see that one time in your career. And I think that's where the Alliance comes in, is with the different hospitals, that it gives our residents a breadth of a breadth of cases that they can see and interact with other attendings and other ways of doing things.
Well, I think you also answered my last question. So I was going to say, what can a resident expect here at Valleywise? But I think you may have already covered it. But if there's any last thoughts or comments about a residency experience, and then I guess just, maybe tell me a little bit about what our residents end up doing. If there's, a lot of them stay here in the Valley, I believe, and do a lot of them stay at Valleywise, and are there opportunities for you to continue to work with them once they become attendings?
There our faculty is very small, so we try to keep our core faculty engaged with all of our residents, and we are unable to retain all of our children, I call them, but that's okay, because we're able to train the next generation of physicians to go out and assimilate what we attempted to teach them, try to make sure that they take care of patients the right way and practice evidence-based medicine and all of those things that we all try to do in our teaching every day we work in the department.
So one of the things that has stood out for me for a while is how humble and compassionate you guys all are. It's kind of, I think, back when it was Maricopa, it was the Copa way, and you're gritty, you're hardcore, but also soft-hearted and very, very humble in the way that you go, present yourselves to the community, to the patients. And compassion, I think, is one of the most important things, and that seems to be kind of the connectivity between all of you. Both as attendings and residents. Is that something that you kind of look for as you're interviewing residents, kind of that special something that knows that they'll fit in this environment?
It's so challenging to find. I guess it's challenging through the interview process because you really only spend a few minutes with each person. The hope is, no matter who comes through those doors, is they're able to see the determination, passion, and compassion of all our faculty, that they are able to assimilate, our entire group. And I think we've done a remarkable job in doing that throughout the years. We have a lot of graduates throughout the city here, and even our former graduates who go to other places on the East Coast to do further training, to work in other facilities. They always comment that they're prepared for almost anything, and I think that's something that I'm proud to say, that I'm proud of this faculty, because we are out there trying to do the right thing for the patient and teaching what we think is the right way to teach an emergency medicine physician.
That's so great. Well, I appreciate you taking time with me today. I know you're busy. You've got a lot on your plate, so thank you for taking the time, and I'm excited for our donors and those involved with Valleywise to get to know you a little bit. Hopefully someday we'll be able to bring folks back down to the hospital and see you in action, and your residents and your team in action. But I appreciate you taking the time, and thanks for all you do for the foundation and for the community and for Valleywise.
Thank you. Thanks for having me, and thank you for what you guys do in the foundation, what you do for our patients. So thank you.
It's an honor.